March is Traumatic Brain Injury Awareness Month, and nearly 5.5 million people live with a long-term disability due to a traumatic brain injury. Here to talk a little bit more about it is Dr. Tim Perry with Frontier Health. Thanks so much for being here today.
Absolutely.
Well, what exactly is a traumatic brain injury?
It is any time that the brain has received some traumatic jolt or some traumatic hit or injury to it. It could be a jolt, it could be a blunt force trauma, anything that would result in some injury to the brain tissue.
What is the difference in a traumatic brain injury and a disability?
Well, brain injuries really fall into three categories: mild, which would be a concussion; moderate; and severe. A concussion, which is the most common form of brain injury. The symptoms may be very mild and may persist for a few days or a few weeks, and then they generally dissipate. The moderate and severe injury can be life debilitating. Those can result in stroke-like symptoms where you have paralyzation, difficulty concentrating, difficulty remembering. It can affect your daily functioning. It can be really life debilitating. So when you're getting into that level of traumatic brain injury where it is really affecting your level of functioning, it can be so debilitating that you do have a long-term disability.
Well, how can people who live with a TBI combat some of the mental health struggles that they may face?
I think the first is recognizing that you have it. A large percentage of people have a traumatic brain injury and never get treatment for it. They may not even realize it until the symptoms are so persistent that they have to have some kind of treatment. So first is recognizing I've had a brain injury, I've had trauma to my brain, to my head, and I need to be checked out and get that assessed. And the first symptoms that you usually find mentally with that is cognitive impairment, difficulty concentrating, difficulty remembering, and that's followed by feelings of anxiety and sometimes deep feelings of depression. If you're starting to have anxiety and depression as a result or following a injury to your brain or a blow to the head, talk to a professional, get some assessment so that they can give you some guidance on how to deal with this and have a long-term recovery.
And what about folks that care for people who have a traumatic brain injury?
It can be extremely stressful because these individuals may change personality. They may have needs for somebody to care for their personal needs on an ongoing basis, and that can be a very life-changing situation for families, and that can be very stressful and very taxing on an individual. So there is support that's available and needed for people who care for someone with a traumatic brain injury. And I would encourage families, seek out that support and that encouragement and guidance from professionals as well as other caregivers.
All right, Dr. Perry, thank you so much. And before we go, we do have some numbers from the Tennessee Department of Health and their TBI program, along with Virginia's Department of Aging and Rehabilitative Services. Those numbers there on your screen.